Hi, all. Today we are going to be going through the long drive case study. And so we'll be looking at this case study, we'll talk through it, and you will have some time to read it and answer the questions. And then I will talk about the answers to those questions. So, right now, what you're going to do is go ahead and read part one, The Grandparents Arrive, and then answer the questions, the 7 questions associated with part one. And then we will or I will, I guess it's not we, but I will talk about the answers to those questions. So go ahead and pause this video now and write down your answers to these questions. Write them down somewhere that you can then submit to the Dropbox later. And so go ahead. Welcome back. Hopefully, you were able to answer the questions and talk and kind of figure out some of it. Just a note, you may have had to do some research for some of these questions. That's totally fine, and you should feel free to do so. And so you can kind of search up if you don't know what might trigger an asthmatic episode, you should look that up and figure it out. The process of looking something up is always really helpful for learning and for remembering things later on down the road. And asthma is something that's really common, and so it's a good thing to know more about. So, question one, what can trigger an asthmatic episode? The first kind of topic of things or category of things is allergens. And so, animal dander, pollen, mold, different things that people can be allergic to. There are also just general irritants that, even if you're not allergic, can irritate your respiratory system. And so, things like smoke, cigarette smoke, really cold air, even can do it. And also getting emotional. And so, some physiological responses will make it harder to breathe in an asthmatic person. There are also other things such as medications, things that you find in food, different additives, and um, definitely exercise as well can contribute to an asthmatic episode. Um, Thinking about what we think happened in this case, um, there are a whole bunch of different things that we're introduced to. And so there's the old toy bear that's all dusty and gross. And then those dust mites on the bear or anywhere in the house might have impacted the grandmother. There's also the cat. And so cat dander is an allergen, right? And so maybe that had something to do with it. There are also some changes in weather. And so maybe the weather is impacting the grandmother in some way. They just came from somewhere far away, it's different here, and so that might be a factor. Um, for this next one, when talking about the kind of the breathing patterns of a person, you want to think about what it feels like to breathe. And so it's a very smooth process. You kind of breathe in and out and in and out. And so if we look at a graph of this, um, you can think about it as like a normal person breathing here. On the inhale, they inhale, and it's kind of a sinusoidal curve, right? We're getting an inhale and an exhale, and they go at a pretty good pace. And it's, it flows. It's not start and stop. It's not sharp inhales and exhales, but that is what it looks like in an asthmatic person, right? And so, in an asthmatic person, you might expect to see something like this, and it'll take longer to inhale and exhale than it usually would, and it's much sharper. The kind of inhale is more drastic. It's happens faster, and it is or not necessarily faster, but the line is steeper. Then for number four, that's number four. Number five, when thinking about which of the airways doesn't have cartilage, the trachea here, up here, the trachea does have cartilage, definitely. Um, the bronchi actually also have some cartilage. And so they are holding their shape a little bit more. But the bronchioles down lower, these that branch off and eventually get to the alveoli, those are do not have cartilage rings holding them in place. Um, and so, what happens during an asthmatic episode is we actually have constriction by the muscles, and so around the different airways, we have smooth muscle, right? And that muscle does what muscles do and it contracts. And so during an asthmatic episode, these muscles are going to contract and restrict the airway, and the airways actually get smaller. And so we can think of this as like squeezing on the trachea and squeezing on the bronchi and the bronchioles. And so those airways are getting smaller, it's getting harder to breathe. Um, when we think about the next question, number 7, why is wheezing worse when we're breathing out? We want to think about what's happening in the body when we're exhaling. And so when we inhale, we create negative pressure, and the pressure decreases. We're increasing the volume, and we are making it so that the pressure is really low, so the air flows in because it creates a differential of pressure, right? High atmospheric pressure outside of your body, low pressure within the chest cavity. The opposite happens when you exhale. And so when you exhale, your diaphragm relaxes, which makes it move up, right? Because contracting the diaphragm moves it down. The intercostal muscles, so the muscles between your ribs, actually pull them together. So it's creating less space in your rib cage. That's a very small effect, but it still happens. And so the pressure ends up being a lot higher during exhaling than inhaling. That increased pressure is what makes the wheezing worse, right? And so there is less space for the air to move through because of the constriction of the muscles. And then the pressure is also really high. And so that makes it even smaller. It decreases the diameter even smaller, which increases the resistance on the airflow and makes breathing really difficult. Okay. So now what I'd like you to do is go ahead and read part 2, and then we'll come back to discuss the questions. So go ahead and pause me. Okay, welcome back. So part 2. The first question is really kind of opinion. Like, do you think this is just a bad asthma attack, or do you think it could be something more? The way these cases go probably lead you to think that it might be something more. When we think about number 2, what could have brought on this episode, there are so many things that could have caused it. In this case, it seems really likely that it was cat dander. But when we look at number 3, at the different symptoms, there were a few different ones, right? And so she was looking really pale. She had pain in her chest, in her neck, and down her left arm, and that was getting worse. Her hands felt cold and clammy and sticky. She had a really fast pulse, or pulse was racing. She was feeling faint, and she had a cough. And so all of these things together kind of make you think that it's a little bit more than just an asthma attack. And so when we think about number 4, when we want to speculate, you might have said that it was an asthma attack, and that was a good guess. You might also have thought heart attack. And one thing that reason that you might find heart attack is because of that pain down the left arm. That's a really common association with a heart attack, but actually, women usually do not experience the symptoms that are commonly associated with a heart attack in men. That is really only happens in men, and it's really unlikely in women. Women present a heart attack much differently, and women's healthcare is actually, it's harder to diagnose a heart attack because they're not really looking for the signs that present themselves in women. They're looking at these um, common symptoms that really only apply to men. And so thinking forward, you might have thought it was a heart attack, but it probably is not. Now we're going to go into part 3. So go ahead and read and answer the questions, write them down. Pause me, and I will see you in a minute. Okay, so looking at part 2, there were a few things that we learned. We got the test results back. And so her heart rate, number one, it is actually pretty high compared to the normal range given in the table in part 4. And her blood pressure is actually kind of low. And so if you look at that table in part 4, you'll be able to see those comparisons. What we can conclude from this is that usually when blood pressure is really low, there are sensors, baroreceptors, so pressure receptors in your arteries and different vessels, and these would cause a reflex response to stimulate the sympathetic nervous system and elevate the heart rate. And so she already has a really high heart rate and she still has low blood pressure. And so that means that this response is not working. Usually that is because blood is being lost quickly from the arterial system, or that the heart is not outputting enough blood per heartbeat. That's called stroke volume. And so one other thing that you could hypothesize at this point is that maybe the blood is not coming back from the lungs. And so the return of the blood from the lungs is low. And that could be due to pulmonary congestion, which is fluid leaking from the arteries into your lungs. And that would explain the cough that she has, where she's producing a lot of mucus. Moving on to number 4, the 2 parameters that we think about are the blood pressure and something called colloidal pressure. And so colloidal pressure has to do with kind of a concentration gradient and thinking about that. And so if we look at our blood vessels, we have our vessel, and inside the blood vessel, we have red blood cells, white blood cells, all sorts of stuff. There are also these proteins. One example is albumin that exist in here, and they're pretty large proteins. And basically, what they do is they take up space and they make it so that water does not want to leave the vessel, the capillary. And so when there's a high concentration of solute, of stuff in the capillaries, then if that concentration is higher than the concentration of stuff or solute in the cells, then water wants to stay in the capillary. It does not want to move down its concentration gradient into the cells because the concentration is higher, of water is lower in the capillaries. And so those are the 2 types of pressure that we're talking about here. And how, as we move from the arterial side to the venule side, so from the heart, from the arteries to the veins and the capillaries, we see that the colloidal pressure is pretty consistent. You can see this flat line here, but blood pressure is decreasing. And so as we get closer to the veins, to returning to the heart, blood pressure decreases because there's all sorts of friction. And as you get further away from the heart, that pressure from the heartbeat is just less. And so that's the answers to number 4 and 5. Number 6 is a really interesting one. And so movement has a few different roles in the cardiovascular system. Moving around is good. It works out it's a cardio workout, right? And so increases your heart rate, gets you moving, always a good thing. But also, as you walk, as you move, your muscles contract, and those muscles are surrounded by veins. Since the veins have really low blood pressure, it's hard for the blood to get back up to the heart, especially in the legs where gravity is really working against it. And so the movement of those muscles squeezes the veins and pushes the blood up the legs. As the muscles relax, the valves and the veins close, which means that they won't fall back down to the feet. The blood will not return to the feet. If you sit for a long time, blood can accumulate in the lower extremities, and this results in reuptake of that filtrate of the water in the blood, um, at the into the tissues, and so the volume of the interstitial fluid increases, and that's what swelling looks like. The swelling is more present in her legs than her arms because your arms are closer to your heart, and so they're not as influenced by gravity. Gravity is really keeping the blood down in your legs. Probably need to do some research for number 8. And so your answers will depend on what your speculation for what's causing this is. You might think that you want to look at the arterial blood gas, like is gas getting across the membrane in the lungs? You might have suggested some tests that would indicate a heart attack. You might look at an ECG or blood troponin C levels. Blood work is a little bit too general, but if you're looking for specific things in the blood, write that down. Okay, time for part 4. So go ahead and pause me, and I will see you when you return. So we got some test results. The ECG and the blood levels of creatine phosphokinase 2 and troponin 1 tell us a few things. Creatine phosphokinase 2 is one of the 3 enzymes. It's an enzyme found in cardiac muscle, and it's involved in the transfer of phosphate between creatine and creatine phosphate and ADP and ATP, and so helpful in creating ATP. After a heart attack, this enzyme leaks out of the damaged muscle and into the blood, and so usually this enzyme is restricted to the heart, but it might appear in the blood if you've had a heart attack and the tissue is damaged and the enzyme has gotten out. They rise to a maximum about 12 to 24 hours after a heart attack. Troponin 1 is one of the 3 components of troponin, which is found in skeletal and cardiac muscle. And so this protein also leaks out of damaged muscle after a heart attack and peaks around 10 to 24 hours. Okay, and so you might be wondering and wanting to predict what would happen to these things, but since they were not abnormal, and there's also a normal ECG, we can kind of say that she did not have a heart attack. And as I mentioned before, the symptoms of a female heart attack may not involve chest pain, which is something that she experienced, and is actually a common sign of pulmonary embolism. So why are her PO2, PCO2, and pH values different from normal? This might be because of a poor exchange of oxygen and carbon dioxide in the lungs. Higher CO2 pressure would mean more carbonic acid and hydrogen ions and a lower pH. And so more CO2, when it dissolves in the blood, actually becomes carbonic acid. And so it creates a lower pH. Number three, are your ideas consistent with her blood pressure and heart rate? Um, at this point, you should understand that there is a something wrong with the pulmonary circulation. And so the blood is maybe not coming back from the heart, which is what we talked about before. And so that would lower the blood pressure and increase the heart rate. Um, Number four, low carbon dioxide levels in the alveoli would cause contraction of the bronchial smooth muscle to try to um, get those back before breathing more. So get more carbon dioxide out before breathing in more oxygen. It's much more important to get CO2 out than it is to get oxygen in. What might cause contractions of the pulmonary arterial smooth muscle? That could be low oxygen levels. And so we don't want too much blood coming in and getting low oxygen blood, not getting enough oxygen from the lungs. The CT scan and the ultrasound were ultimately to look for blood clots. And so there is a condition known as deep vein thrombosis, where blood clots can be in the veins that are deep within the leg. And so you need to use a CT scan or an ultrasound to check for those. These clots would be a potential source of embolisms. An embolism is a blood clot that has moved. And so if a blood clot has moved to the lungs, then this would make sense with everything that we've noticed. And so you should be able to tell that there's a problem with the pulmonary circulation. You might wish to do a CT of the chest to see if there are any blood clots up there, or something else testing for the blood flow in the pulmonary circulation. All right, go ahead and read part 5. This takes place a few days later. Write down your answers to the questions and then come back to me. Okay, so a VQ scan would tell the doctor about airflow. The results that we got indicate which areas of the lung are being ventilated. And so where is air moving? And so this will tell us whether or not there's a problem with airflow. The VQ scan tells us also which area of the lungs are receiving blood. And so this would tell us if there's a problem with the pulmonary blood flow. Number 3, why should Barbara not take aspirin or ibuprofen? These drugs are non-steroidal anti-inflammatory drugs, they actually affect prostaglandin levels, which some of you should know from our drug project this fall, but they ultimately affect clotting. And so ibuprofen and aspirin may have a negative effect on someone who's already experiencing weird clotting patterns. How does warfarin control the clotting time of blood? Some of you also might know this from our drug project, but basically warfarin inhibits the production of vitamin K. So this inhibits the synthesis of the biologically active forms of vitamin K dependent clotting factors. And so these clotting factors use vitamin K to become active, and then go and clot. And so warfarin would stop this from happening and lower blood clotting, or make it take longer for blood to clot. And so number 5, if Muffy the cat ate warfarin, which is used as rat poison, as poison, what would be the vet's treatment? Since warfarin inhibits vitamin K, you're going to want to give them a shot of vitamin K immediately, and then kind of analyze from there. So doing some blood tests, clotting time analysis. If it was really close to the time of ingestion, you might want to make the animal vomit to try to get it up. But that's a really interesting question to think about. So I hope this was helpful. I hope this was a fun case study for you. It's really interesting to think about the interconnectedness of the pulmonary system and the cardiovascular system. They really depend on one another, and their symptoms, because of that, often overlap. And so I hope that this was helpful for understanding those overlaps and thinking about how blood flow and airflow cause different things. All right. Thank you all.